One of the first things most of us do after we find out we have MGD is try to figure out why it happened. We know there are lots of things that can be connected to MGD and dry eyes. Hormone issues, immune system problems, inflammation, rosacea, blepharitis, certain medications like retinoids, lifestyle factors, and probably a bunch of other things we don't even fully understand yet. When I started looking for answers, I did what a lot of people do. I went down the rabbit hole. I did a lot of tests trying to find some kind of explanation. I'll leave the tests I did in the description below in case they help someone rule out a few things. But here's what I found really interesting. The more time I spent in dry eye groups, Facebook communities, and on Reddit, the more I noticed that there are a lot of people who checked everything they could think of and still couldn't find a clear cause. No obvious hormone issues, no immune system problems, no inflammation, no clear explanation. And that got me thinking, what if sometimes the answer is actually much simpler? In my case, after looking at all the possibilities, I kept coming back to two things: 25 years of contact wear and really poor blinking habits. But even poor blinking habits doesn't feel like the perfect description to me, because I think it's maybe more about a mismatch between how much oil your glands produce and how often that oil gets released through blinking. Like, imagine two people who both blink less than they should. One person naturally produces a small amount of oil, the other produces much more. Well, it kind of makes sense that the second person might be more likely to run into problems, because there is simply more oil sitting inside the glands. So maybe in some cases the issue is not just blinking, maybe it's the balance between oil production and blinking frequency. And if this imbalance really is the root cause, then of course one of the first things to work on is your blinking habit. But I also don't think that simply starting to blink more can always undo a blockage that has already been building for years. Once the oil has become very thick and the glands are heavily blocked, they may need additional help. And how much help probably depends on how early your symptoms started and how severe the blockage has become. For some people, regular warm compresses at home may be enough, especially if the problem is still relatively mild. In other cases, stronger or more controlled heating and professional gland expression may be needed. And that was the situation in my case. My glands had been slowly filling with the very thick oil for years, so changing my blinking habits alone was not going to clear them. So yes, sometimes the course may be relatively simple, like years of not blinking enough for the amount of oil your glands naturally produce. But even then, dealing with glands that have been blocked for a long time can still be a very difficult and gradual process. And I know it myself. And I think contacts may be similar. We often hear that contacts can contribute to MGD, but they may do it in different ways for different people. Some people may develop inflammation. Some may have other changes happening around the glands. And some people like me maybe simply blink less when wearing contacts because their eyes just feel comfortable. Of course, it's just my personal theory. I can't prove that's exactly what happened in my case. But after ruling out so many other possibilities, it's one of the explanations that makes the most sense to me. At the same time, if the root cause is something happening elsewhere in the body, the situation may be more complicated. Then there may be two separate things to work on. First, trying to identify and manage the underlying cause, and second, helping the glands themselves function better.